Welcome to the Alfi podcast, episode number 45. Today's going to be a little different. You're not going to want to miss this because today I am the guest. Gigi.
And I'm the interviewer.
Gigi is your interviewer. What we're doing today is a little different. It's going to be 15 minutes with Dr. Alfi. Is that what we're calling it?
Yeah, I want to say like 20 minutes because we
Okay.
are going to go into detail with a couple things. But the gist of this episode is to speak about questions that patients have regarding our practice and how we do things. So today we are going to be discussing basically the timeline of seeing us from beginning to end, pre-op visit all the way up until graduation. So we're going to sit down and talk about what patients should expect at each visit and how many times they should expect to see us.
Awesome. Looking forward to it. You're not going to want to miss this. It's what actually happens when you come here, especially we get a lot of patients that are coming out of town. So on the first visit, that's really the first consultation, right? And what we're doing there, it's very comprehensive. The patient's going to meet with me and the team, and we're really going to try to establish, what are their symptoms, what are their chief complaints, and what are their goals. And by the end of that visit, we're trying to establish a treatment plan, making appropriate referrals for everything they need, and then give a real clear staging of what's going to happen in their journey. Everybody's a little different with this, and I'm going to get a little deeper into that.
Okay.
For example, and then by the end of the visit, we're going to make sure that they have all the information they need from their financial standpoint, meet with our coordinators. So how this works is on the first visit, we're going to go through the history, the physical examination, just like you would with your primary care doctor, right? And in that, it's really an interview where I'm listening about what are they struggling with, what are their goals, and then I'm going to use my expertise to start deciphering a little more about that. There's some things that we can uncover that a patient often isn't aware of based on their examination, based on their questions, based on their symptoms, and we're going to uncover those. We're also, besides the interview, the discussion, the physical exam, where we're looking at the teeth, the bite, the entire body, for example, taking important measurements that are going to be necessary for planning purposes. We're going to get what's called a cone beam CT scan as well, CBCT. It's basically a 3D image of their jaws and their teeth. And the nice thing about these modern CBCTs are they give you 3D CT images, but they're also very low in radiation.
Okay.
So less than, for example, a flight from here to New York.
That's
in terms of
crazy.
radiation. Yes. And similar to just plain dental films. And we get a lot of information from that cone beam CT. In the cone beam CT, and we could put these images for people. We also get to see the airway size, and that's when you see, the red versus blue ocean. Of course, most people that are coming for their initial consultation, unfortunately, don't have a blue ocean, but that's why they're there, and that's our goal, to give it to them. We're looking at the teeth, the health of the jaws, looking for pathology, looking at the sinuses, the septum, the nose. There's a lot of information we're getting from that 3D CBCT. Sometimes we'll also get an intraoral digital scan of the teeth if we're needing more information about, the staging of the orthodontics before or after if necessary. Sometimes we do surgery first, sometimes we do braces first. This is a visit where we can help determine that and make appropriate referrals to the right orthodontist for that patient as well.
Mm-hmm.
So after exam, discussion, CBCT, then
Wait,
I have...
you forgot one thing.
Yes.
Pre-op photos.
Oh, and photos, of course. We're
Yeah.
taking photos at every visit, and we'll
visit.
get into that. Yeah, we want good documentation of the facial form,
And also
the smile, the bite, all these things.
And also, if you do have patients who you have do orthodontics prior to surgery, you also like to have that for your planning as well.
What do you mean by that?
Like you like to have photos from the initial visit
Oh,
and see
yes.
the progress
Yes,
into the
for
next
sure.
visit. Because sometimes what I have seen is patients will come in for their initial visit and they are not a surgery first patient, which most people are not. You have to have,
It's about half.
okay, yes. But for those patients, you know, there are orthodontics first prior to surgery, and
Yeah.
because you have to set
We
them up for
still want
surgery as
we
well.
still
So you
want the
like to have
starting
that.
photos, because you're right, and that's when the patient is coming at their true form,
Mm-hmm.
or at least at that time,
Yeah.
right? So I do like getting photos at every touch point,
Yeah.
and we'll get into that in the next visits, the photos as well.
Okay. Perfect.
And then with the exam, with the interview, with the photos, with the digital teeth,
Mm-hmm.
um, I have all the information to start making a plan.
Right.
And then this is going to be different for every patient. Sometimes we don't recommend surgery. Sometimes the patient's not a right fit for surgery. But often patients are good candidates for surgery.
So
Right.
before we go on to visit 2, 3, and so on,
Mm-hmm.
what makes a patient a candidate and what makes a patient not a candidate in your opinion?
Yeah. So, most people, and the audience has heard this, you've heard this. Most people, from an anatomical and physiological standpoint, are good candidates for jaw surgery, meaning most people really do need the help,
Right.
right? And what this means is that, modern jaws are a lot smaller than they should be.
Correct.
And people need their wisdom teeth out because their jaws are too small. They need premolars. There's no space for their premolars or their canines because their jaws are too small. They've had crowding in their teeth and needed braces because their jaws are too small. This represents like 95% of the population.
Right.
And beyond that, if the jaws are too small for the teeth, they're too small for the nose and they're too small for the tongue, right? So the airways are compromised. And a compromised airway is always going to lead to disturbance in sleep.
Right.
And that is so pivotal for every organ system in our body and our entire health and wellness.
Right. Sleep is the number one health
Yes.
hack.
So, the reality is that the majority of people need the help
Correct.
with jaw surgery, the number one biohack.
Yeah.
But doesn't necessarily mean if they need the help, they're good candidates
What do you mean by
for
that?
surgery, because it's really a partnership, right?
Mm-hmm.
There are people who don't exercise, smoke every day, drink every night, have terrible hygiene, are obese because of their choices. They're not respecting their body. Surgery itself is not going to make someone well.
That's correct.
Does that make
Yeah.
sense? And not only is it not going to make someone well, if all the other things are not respected, the healing is also can be compromised.
Yeah.
So, and that even goes with mindset. There are actual studies, and we can share these studies as well, as how a positive mindset results in better healing, and how negative mindsets result in poor outcomes. Right? There's interesting literature in the orthopedic literature that's well documented and established about workers' comp patients. These are patients who are seeking orthopedic care through the lens of workers' compensation, meaning that there may be an intention not to go back to work, right? And having, depending on resources based on those disabilities. The same operation, but under the lens of a workers' comp eye, those patients have significantly worse outcomes and satisfaction.
That's
And
interesting.
it is very interesting because it's how much of that has to do with the mindset of wanting to get better versus not wanting to get better.
With all of that, it's whether you're willing to push yourself through the healing process in a positive way.
Yeah, definitely. I mean, we talked about this with Ben Azadi when we had him on the podcast about how your mindset and what you speak of actually translates to expression
That's
at the
correct.
genetic level, right? Like
Yeah.
this stuff is real scientifically and physiologically. So what you speak of becomes, and it's manifestation. We know this in common life, but it's true in the body as well.
Yeah.
Right. So,
Because your mind is a very powerful thing.
very powerful. So if you have a negative victimhood mentality, that's going to translate to negative outcomes.
Right.
So these are some things that we need to recognize, and those patients need to become aware of so that they can start changing
Their mindset.
so they can have good outcomes, you know. And for the same thing, it's like there's a lot of responsibility that goes into surgery. And it's not just operations. Operation can go extremely well, but if there's non-compliance or poor mentality, or a lack of respect for the body, then healing can be compromised. And even with good outcomes, satisfaction can be compromised. So
That's right, yeah.
So it is important that we recognize people that are respecting their bodies and people that aren't, and drinking excessively, making poor decisions. Those things are important, right? So we do want to attract and recruit patients that are taking care of themselves, you know.
What do you mean by that?
That they're trying what they can on their end, because yes, people have a small jaw, they can't sleep well, they're tired. That can lead to increase in weight. That can lead to, you know, excessive fatigue, tiredness, all these things, and that's what we're trying to fix. But at the same time, if they're not trying to sleep 8 hours a day, you know, if they're sleeping 2 hours a day, for example, they're not putting the effort for sleep hygiene, right? So you have to try to do all the things right, and then you'll have the best impact if we fix that structural component to it, right?
Okay.
So we really do want to stress the importance of wellness and the holistic approach, and that comes from not only the physicians and doctors, but it comes from the patients themselves.
Yeah. So all in all, it is a partnership.
Yes, all in all, it's a partnership, and these are things that we can try to weed out during our first visit, right?
Awesome.
So at the end of that visit, I will have given the patient not only their diagnosis, uncover what they're dealing with, confirm or not their structural issues, and then make a recommendation of what's the best plan of action.
Right.
Is that ortho only? Is that no surgery at all or no treatment at all, which is rare? Is it expansion only, or is it a MARPI expansion staged with surgery afterwards? Is it surgery first? Is it braces, then surgery? And so we're going to be able to get all that information and then help the patient plan those things out, right?
How often is it that a patient comes and gets surgery and they don't need any refinement afterwards with ortho?
It's rare. Yeah,
Most of the time
it's rare.
they need
It does
refinement.
happen. I would say maybe 10% of my patients, or 5 to 10%, you know, they were surgery first. They had good bites. We do the surgery and everything lands perfectly where they didn't need a orthodontic. But I would say that's not an expectation. The expectation is that even if they're surgery first, they're going to need ortho afterwards. So we've made a policy that everybody has to have an established orthodontist.
I like that.
And a confirmed plan of care, even if they're surgery first, if we're going to proceed with surgery. We're going to do staging. We're going to help the patient come up with the appropriate providers and timeline. So that means a myofunctional therapist that's right for them if they need it, which most people do, an orthodontist that's appropriate for that person. You know, any other providers. We're going to sometimes refer for a sleep study if they haven't had a sleep study. So we're going to take care of that. If there are some things we uncover in the physical exam that needs different specialists, we'll pull those in, and et cetera. So it's really a comprehensive exam, data collection, diagnosis, and treatment management. And so the patient can get a full picture of timeline and everything they need to know to get into surgery. And then at the end of the visit, we always have them meet with our amazing insurance coordinators to discuss with them. A really important topic is how are they going to afford to do this surgery. And thankfully, our coordinators are really, really good at getting insurance to cover it. We're in network with Blue Cross Blue Shield, PPO at the moment. We're going to try to be in network with more insurances in the near future. But our coordinators are then at the end of the visit, break down the next steps for the patient, go through the finances, confirm or not confirm their insurance criteria, so that by the time the patient leaves that first visit, they have a lot of information and a plan of action.
So let's move into visit 2. So let's say this patient is a candidate for surgery. You've done all of that. What happens next?
So after that, usually There may be some in between patients, meaning they have to come for a follow up to see if they're ready or not. But usually, after that first, the next time they're coming is when they're ready for jaw surgery.
Okay.
And whether that's surgery first or they've gone 3 to 6
Through
months for ortho and then come back. And what we do is we have this visit as the pre-planning visit.
Okay.
And this visit usually takes about 30 minutes to an hour. And in the pre-planning visit, what we're doing is we're getting all the data we need to plan the case to make our custom jaw plates and screws and our guides. So
Okay.
everything is custom made. And it takes about a month as a whole, and sometimes a little less, but we like to plan a month ahead of time so that we can plan the case, and I'll get into that. We can produce the implants. The implants are 3D printed titanium, specific for the patient, specific for their movements. It's very precise, and they're printed in Belgium. So
Cool.
we need time to make them, design them, plan the case, bring them over. So we usually like to have the pre-planning visit 1 month before surgery. For
Okay.
patients that are coming out of town, they usually come in the morning. We do that pre-planning visit, and they go back on a flight, catch a flight back home.
Okay.
Usually those are just in and out patients.
Can this visit be done in the cities that we see them at outside of Houston, or do
It
they
can.
have to come into Houston
Yeah.
for that?
It can. Yeah. What complicates that one for some people is the insurance, because we're only
Okay.
a network here
Correct.
in this city. So for the Blue Cross patients, they're usually going to want to fly here to do pre-planning visit, because then that visit is covered under insurance. If they want to see us locally in their hometown, like LA, Miami, New York, when we're there, it can be done, but it's going to be under the self-pay.
Okay.
So for self-pay patients that are not or out of network, then there's no difference. But for the Blue Cross in network, to get the coverage, they're going to come here to Houston to do that.
Okay.
But that's usually a day trip, and people make that without an issue. And then after that, we have a pre-op visit, usually
Okay.
1 to 2 weeks. We like to do before surgery. And in the pre-operative visit, what we're doing is I'm showing the 3D plan and the designs of the plates.
So everything's done by visit number 3 as far as setup. You're
Yep.
just showing it to the patient to
Correct.
confirm.
We're showing, discussing. Of course, during that previous visit, pre-planning, I'm getting all the desires and thoughts of the patient to put into the planning process. But at this point, I'm showing them the plan, the exact numbers and measurements. We're removing things. And then we're also going through consent, and we're really discussing at this visit what to expect, what to expect in surgery, after surgery, what are the instructions to get through surgery. Usually I like patients to bring their support system with them so they can hear it too, because it could be overwhelming. We're giving all the information to get the patient through the operation.
And this is when they meet with our nutritionist and our psychiatrist, correct?
Yeah. So we usually like to coordinate that. We have an in-house psychiatrist and a nutritionist. They're both amazing. This is Yvette and Dr. Andre. And the reason I did that was to get the best experience and outcomes for surgery. This is unique to AOS here.
Mhm.
I wanted the ultimate experience, and we're going to continue to add things to make the experience the best in the world. So I do think that mindset is important, and our psychiatrist is really experienced, really good at not only, unpacking things that may be causing anxiety, or even picking up things that may be an issue in terms of recovery, and then helping give support to get patients through it. Sometimes that might be, if they're on anxiety medicine, for example, it may be looking into that, or providing a plan of action, because surgery is stressful. And if someone is already anxious, it can make them more anxious. So having that psychiatrist on board has been a game changer, really important support for the patient, and that's been received really well. And then nutrition, holistically, nutrition is so important to make sure that we have the protein to heal, that we're eating clean. The diet is going to change because we're going to put the patients on about a 2 or 3 3-month non-chew diet, right? So that's going to change the type of foods people are eating, and we want to make sure that those changes are responsible and healthy and adequate and all these things.
And don't inhibit the healing process.
Correct. So Yvette's been really instrumental in helping patients navigate that aspect of it. So yes, at the pre-op, whether it's combined on the same day or a different visit, it's going to be showing the case, going through consent, going through what to expect, going through instructions post-operatively, making sure the prescriptions are ordered, and making sure that, if there's clearances, for example, with cardiologists, endocrinologists, rheumatologists, that we're ironing out all those details to optimize the care for the patient. And that all happens in that pre-op visit. And then they'll meet with a psychiatrist and nutritionist as well.
Awesome. So then let's go to visit 4, surgery day.
Yes. And now that pre-planning visit, for patients that are out of time, sometimes we'll show that to them virtually.
Oh, okay.
Although we want to get them here.
Yeah.
In person preferably, but
so
sometimes
that's very rare.
Sometimes because of convenience and timing, patients will want to see the plan ahead of time, so we can arrange for them to see the plan, and then pre-op in person could be when they're here for surgery, maybe the day before, for example.
Okay, so let's hop into surgery day.
Then surgery. On surgery day, for patients who are out of town, we like them to be here 5 to 7 days. And we have relationships with hotels here in the medical center that are very comfortable, convenient, affordable. But what'll happen is they'll arrange to be here 5 to 7 days. Obviously, this doesn't apply to people that live locally.
Right.
So then we'll meet them at surgery, usually in the morning. Surgery takes about an hour and a half. Obviously, I'll meet with the patient in the pre-operative bay before surgery. Usually they're with a loved one or supporting person. We'll go over any last questions or anything they want to talk about. Get into surgery. Surgery will take about an hour and a half. Then I'll go meet the family member or support system in the waiting room, let them know how surgery went. Thankfully, surgery went great.
Yep.
And then they'll go to the recovery room, usually for about 2 hours. And then after 2 hours in the recovery room, they'll go with the family to the overnight room.
Awesome.
And we'll usually keep people overnight for one night.
Mm-hmm.
Some people want to stay another night or just need a little more time, but most of our patients are there one night. I'll come by and see them the next morning and see how they're doing. Obviously, during that day, I'm checking in with them as well, but I'll always go see them in the morning, and usually they're ready to get out and go to the hotel or go home at that point, so we'll let them go from there.
And then after you release them for the day, then they come back for visit number 3?
The post-op visit, yeah.
Oh.
So
that's 5, visit number 5, correct?
Yeah. Well, let's see. So there's the initial.
The initial.
There's the pre-planning, the pre-op, which may be in person or not.
Yeah.
Surgery. And now post-op.
Yep. So post-op is number 5.
Which is on their same trip.
Correct.
Right. Actually, these 3 are on their same trip.
Yeah.
Because it's within that week. And usually I'll see them day 4, 5, or 6 after surgery here in the office, and we'll take another CBCT just to verify positioning, the plates, the hardware, all that stuff. We'll check on them, make sure they're healing appropriately, and they're always, ready at this point to travel back
to where they
are. And that's the point where they're getting through the hardest part, which is not pain usually, but just swelling
and discomfort.
The swelling starts to go down at that point, and most people are ready to fly home or get back. Even if they're here locally, then just get back to normal things. Most people go back to work after that one or 2 week mark. Okay. Yeah, because things get a lot better after week 1. So after that 1 week post-op, then I usually, there's obviously patients that have differing issues, but usually it's going to be a post-op at 6 weeks, at 3 months, at 6 months. Okay. Those can be in any city that we're at.
And in that's where we grab the photos.
Yeah, so photos at every visit. So at 6 weeks, we're not taking a CBCT at 6 weeks because at that point, we're not expecting bone to be fused yet. We're just making sure that the bite is still aligned, the wounds are healing well, that there's no signs of any complications or issues that need to be addressed. Right. and usually those visits are fairly short, just checking in. Patients are still on a non-chew diet, so there's not much change in the 6 weeks. It's more of a check-in to make sure everything's appropriate.
Right.
Then at the 3 month, that's a pivotal appointment for most patients, because at 3 months I'll take a cone beam CT, another CBCT. At that point, we're expecting to see that everything is stable in the right place, but also that the bones are fused,
Right.
that there's bony healing. And at that point, I usually release patients to resume normal activity, meaning chewing, all types of exercise, contact, and that stuff. Now, back up, exercise I want happening after week 1.
Just no physical,
no contact.
No like contact
or anything
sports.
jolting, correct.
Yeah. But they could go on
3
a
months,
walk, they could even run.
Yeah, we want them to go, even go on a Peloton, get
Weight
active,
training.
do weights, all that stuff. But at 3 months, there's really no restrictions for most patients, but we're verifying that on that visit. And then after that, it's either a 6 month or a 1 year. Once they're done with their braces and everything should be healed and over
And
with.
they graduate.
And they graduate from our office.
Amazing. So it seems like we have a pretty good timeline for patients to follow.
Yep, that's great. So that's summary, right?
Yeah.
Summarize those visits and rewind to see what those visits are. But first one is, we talked about our first consult. Second one is usually the pre-planning visit. Then within the same trip, it's usually the pre-op, the surgery, the post-op. And then there's the 6 weeks and the 3 months.
And the 6 months.
And then 6 or 12.
Amazing.
Yeah. And then hopefully at that point, people are pumped and want to get on the podcast, which we do have a lot of patients that are interested in getting on the podcast. And I think that's going to be important to continue to share patients' original stories and experiences. And I think that that's going to be helpful.
Awesome. Well, thank you so much for sitting down with us.
Thank you, Gigi.
Letting me interview you for our patients.
Yes, you and Karma did an amazing job. I think
he slept the whole time. So.
I think that this will be valuable if you guys have more questions and want to see these 15 minutes with me to go over specific stuff about the journey, or we can get into planning. We can get into a lot of different aspects of surgery and the number 1 biohack. If you have questions for it, put them in the comments below.
Or even send us a message on Instagram. I usually monitor those messages. Yep. So I will make a list of questions that you guys have for us, and we will review these on a bi-weekly, maybe monthly basis, depending on how many questions we get.
Yep. And stay tuned. We have an amazing lineup of guests coming on to the Alfi podcast. Yes. You're not going to want to miss them. And remember, don't forget, subscribe, share, comment, and we'll see you soon.
See you soon. Bye.